Hi, my name is Orla McCarthy. I'm a women's health physiotherapist in Cork University Maternity Hospital, part of Ireland's South Women and Infants Directorate. I know some of you might be a little bit nervous about labour, but there's a lot you can do to help yourself. Something as simple as how you position yourself can make all the difference. So today I'm going to be demonstrating some positions that you can use in labour. I'll also teach you some very simple breathing techniques, and at the end we'll go through how to push effectively and safely. So using a gym ball for labour can work really well. It's really nice if you've pelvic girdle pain, and it's something you can practice in the run up to your labour as well. So choosing a gym ball is important. You need to make sure it's the right height for you. So when you sit on a gym ball, your hips should be ever so slightly higher than your knees. There are different heights. There's 55 centimetre, 65 centimetre and 75 centimetre. Using the gym ball, you can bounce on the gym ball. Bouncing on the gym ball is very soothing again. It's introducing a little bit of movement, which our body recognises. And bouncing on the gym ball can really help soften your perineum, which is really nice for labour. You can also introduce some circling on the gym ball. And you can switch directions. It's really nice if you're getting a lot of back pain through labour. And the other thing that you can use the gym ball for is to do some pelvic tilting. So when you're tilting your pelvis, you're rolling backwards onto your tailbone and then you're arching your back. By sitting on the gym ball, you can also lean forwards, resting your hand in front, and this can help open up the pelvis. So if we look at our pelvis, during the first stage of labour, it's important to use gravity, as this will help your baby descend down through the birth canal, and also it will allow your baby's head to press gently on the cervix. This will make your contractions much more effective. Another nice position is to choose a standing position, and you can lean against something. So it could be your worktop at home, it could be a windowsill, it could be your partner. Today I'm going to choose the chair and I'm going to lean against this. So once you're leaning against it, resting your elbows on it, you can widen your stance, and it's quite nice even to introduce a little bit of movement. You can sway your hips from side to side. You can also introduce a little bit of circling with the pelvis. Movement is very soothing and distracting. Your body is designed to move and it will help you cope with the contractions. Another nice movement to help you through labour is to consider some walking. You might be walking at home, you might walk around your house. You can also use your stairs. There's stairs in the labour ward that you can use also to help things progress. If you have pelvic girdle pain, you might want to avoid too much walking on stairs, as this will worsen your pain. You have your pubic bone in front and you have your tailbone at the back. The first stage of labour is all about creating space in the pelvis, and by sitting on a gym ball and opening your hips far apart from each other, you're actually widening that space in your pelvis. By leaning forward slightly or by tilting your pelvis forwards, you're actually moving the tailbone out of the way, and you're making it much easier for baby to move down through the birth canal. Another really nice position is to straddle a chair. You need a chair without any armrests. Again, if you have pelvic girdle pain and you're experiencing a lot of pubic bone pain or groin pain, this might not be the best position for you, but otherwise it can be a really nice position that you can use at home. You can keep a pillow in front to make it a little bit more comfortable, and you can rest your hands in front. You can even relax into that position. And you might get your partner to do some back massage as well, depending on how you're feeling. You can also use the chair to place one foot on the chair. This will help open up the hip and the pelvis. You might switch positions so that you start off with the right leg and then you move so that you have your left foot on top of it. So I'm here with Olga, one of the labour ward midwives, and the next thing we're going to show you is the cub. This stands for comfortable upright birth. It's available in the labour ward and it can be really nice for your labour. So Olga's going to come down into a forward, kind of a lean position. So this can be really nice to create a little bit more space in the pelvis, and it's nice if your back is getting a little bit achy. And I might get Olga just to open up her knees a little bit wider. Again, it's all about creating space in the pelvis. Some of you might be a little bit tight in your hips, so it's really nice to think about putting a pillow underneath the bum. You can relax back. And again, you can even change it up into another way. If you're a little bit stiff in your back, you may need a pillow underneath your elbows. And I might pop this underneath here. And again, you can get your partner to massage your lower back, which might be really soothing for you in labour. And this might be a nice resting position that you might use for the first stage. You can also come down onto a kneeling position, onto your bed or onto the floor on a mat, and you can use your gym ball and you can actually rest over the gym ball. This can be a really nice position for the first stage of labour because again, you're upright, you're using gravity, and you can widen your hips to create a little bit more space in the pelvis. And by leaning forwards, you're tilting your pelvis and you're moving the tailbone out of the way. If you're getting a lot of low back pain, you might like to use your gym ball to stretch the lower back. You can roll the gym ball to the side. And you will be using your breathing techniques when you're doing this. So you can also go into a 4-point kneeling position. So placing your hands directly underneath your shoulders and your knees directly underneath your hips. And in this position, you might rock from side to side. You might do some gentle tilting of the pelvis. It's really nice, again, if you're getting a little bit of low back pain, and it's just a nice position to transition to. So I'm here with Olga again, and we're just going to show you some nice positions that you can do when you come into the labour ward. The labour ward has special beds that are designed to move into different positions to help you and your labour progress. So Olga's going to come into a lovely forward lean position. So you can see it's really comfortable for the mother. She can move, she can sway her hips. It's really nice for her back, opening up that area. And again, she can open her knees out to the side to create a little bit more space in the pelvis. If you find you're getting a little bit tired in this position, there is also the option of putting a pillow underneath the bum if you feel like sitting back down onto your heels. So next I'm going to talk about the peanut ball. So they have a few peanut balls down in the labour ward. They're really useful for labour. You can use them throughout labour. There are different sizes depending on your height. If you have been experiencing pelvic girdle pain in your pregnancy, the peanut ball can be really nice to try and maintain that active labour. So there's lots of different positions. The first one we're going to show you is side lying with the peanut ball between the legs. So the bottom knee needs to be bent, and then you place the other leg over it and just get into a position that's comfortable for you. Nice and relaxed. So you can also use the peanut ball for the tuck position. So with this, you're using your hands around the peanut ball and you're almost hugging it towards your body. By doing this, it's like you're in a squat position, and again, you're really opening up the pelvis at the back. This is going to help your labour progress, and being able to hold on to the peanut ball during the contractions can help you cope with the pain as well. For the second stage of labour, it's important to remember to avoid lying flat on your back when you're pushing as much as is possible. For the second stage of labour, you can pick side lying, you can go into an upright sitting position, you might like to go up onto all fours, or you may even stand to birth your baby. If you've had an epidural, you need to remember that you're a little bit less mobile, so you can go into a side lying position, or you can go into more of an upright sitting position. Another nice technique to help you cope through labour is using different breathing techniques. When we are anxious or a little bit stressed, or if we're feeling any type of discomfort, the first thing we tend to do is to hold our breath, or we start to breathe quite shallow. And when we breathe like this, we're not getting enough oxygen in. We can start to feel a little bit dizzy and a little bit lightheaded. So I'm going to teach you a really nice breathing technique that you can use throughout your labour. It's really nice for contractions, and it's called relaxed abdominal breathing. When you're doing this technique, you can do it in a sitting position, you can do it on a lying down position, or you may do it when you're sitting on the gym ball. But place one hand over your chest and place the other hand over your bump or your tummy. And in your own time, breathing in through the nose, picturing the air going down through the windpipe. And as your diaphragm moves down, it allows your lungs to expand and fill up with air. So what you should feel at home when you're doing this is you should actually feel like the lower hand gently rises first as your tummy moves outwards. So breathing in and breathing out. And try and let the tension go from your shoulders with each breath out. Breathing in through your nose and breathing out. Make sure that you don't force the breath out. Allow the breath to gently exhale and work with your breathing. Some of your breaths will be deeper than others. Using this relaxed breathing technique will help you feel calm, it'll help you feel control, and you'll be getting lots of oxygen-rich blood in to help you and your baby throughout the labour. Also, when you breathe like this, you're getting a gentle relaxing and a lengthening of your pelvic floor, which will help you birth your baby a little bit easier. Try and focus on each contraction, focus on each breath. Try not to let your mind race ahead. It's a really nice technique for you to practice in the weeks running up towards your labour. You can practice it before going to sleep, and the more you practice it, the more natural it will come to you in the day. As labour progresses, it is normal for your breathing pattern to change slightly as your contractions become a little bit more intense and frequent. A nice technique to help with this is called SOS breathing. So with this, you simply keep a nice kind of pursed lip and you're just breathing out a little bit like you're blowing on birthday candles. So switching to this breathing technique can help when the contractions get a little bit more intense. When you are pushing, it's really important that you tune into your body and you will feel the urge to push and work with it. It's really important that you don't hold your breath during the pushing because this can put a little bit too much strain on your pelvic floor. So when you're pushing, you want to keep your throat open, so open glottis, and you're going to be pushing down, bearing down towards the back passage, a little bit like you would if you were emptying your bowels. So breathing in. You can gently tuck your chin in. This will help divert the pressure downwards during pushing as well. So just to repeat, breathing in, tilt your chin and breathing out as you bear down and push down towards the back passage. The reason why we get you to push and bear down towards the back passage is because these muscles are stronger. So remember, do not hold your breath when you're pushing, breathe out. Thank you for listening. I hope you found this video useful. Everything I have mentioned is in the manual, mychild.ie, and you can also check out their website. I wish you all the best for your labour and I hope it goes well.